What if the foods on your plate are silently damaging your prostate every single day? Sounds alarming, right? But it's true. Some everyday favorites might be fueling inflammation and quietly making prostate issues worse without you even knowing it. Whether you're looking to prevent problems or improve your prostate health, knowing what not to eat is just as important as what you should. From sneaky snacks to seemingly harmless meals, these foods can throw your hormones off balance and stir up trouble. And wait till you hear about number 5. It's the one nobody expects, and it might be sitting in your kitchen right now. Let's jump in and uncover the foods your prostate wishes you'd skip. First, we have alcohol. Many people don't realize that alcohol is not just harmful to the liver or heart. It can also negatively impact prostate health. The prostate, a small gland responsible for producing seminal fluid in men, is sensitive to certain toxins and behaviors. One of the biggest contributors to prostate issues is the consumption of alcohol, which has various properties that can exacerbate problems in this area. Understanding how alcohol interacts with the prostate is important in maintaining optimal health. Alcohol acts as a diuretic, which means it increases the frequency of urination. For men with an enlarged prostate, this can be especially problematic. The prostate naturally enlarges as men age, and frequent urination can lead to irritation and discomfort. Alcohol's diuretic effect can worsen these symptoms, causing more frequent bathroom trips and added strain on the prostate, leading to further discomfort. In addition to being a diuretic, alcohol is a known inflammatory agent. Chronic inflammation is one of the major contributors to prostate problems, especially conditions like prostatitis, inflammation of the prostate, and benign prostatic hyperplasia, BPH, which involves the enlargement of the prostate. Alcohol has been shown to increase levels of inflammation in the body, making it harder for the prostate to heal and function properly. This can result in more painful and uncomfortable symptoms, especially for men dealing with prostate-related issues. Moreover, alcohol can impact hormone levels, particularly testosterone, which plays a crucial role in prostate health. High levels of alcohol consumption can lead to an imbalance in testosterone and estrogen levels, disrupting the normal functioning of the prostate. This imbalance can encourage the growth of prostate cells, leading to enlargement or even the development of prostate cancer. The hormonal disruption caused by alcohol intake may also make it more difficult for men to fight off prostate-related diseases. Another important factor to consider is that alcohol is metabolized in the liver, and excessive drinking can lead to liver damage. A compromised liver may not be able to properly process and remove toxins from the body, which can affect the overall health of the prostate. If the body is overloaded with toxins, the prostate becomes more vulnerable to oxidative stress and cellular damage, increasing the risk of various prostate conditions, including cancer. Alcohol also dehydrates the body, and dehydration is another factor that can aggravate prostate problems. The prostate gland requires a certain level of hydration to function properly. When alcohol causes dehydration, it can lead to an imbalance in bodily fluids, affecting the prostate's ability to produce and maintain healthy seminal fluid. Dehydration may also exacerbate the discomfort and urgency of urination in men with prostate issues, making the situation worse. In addition to these physiological effects, alcohol consumption has been linked to poor dietary choices. When alcohol is consumed, especially in large quantities, it often leads to cravings for unhealthy, processed foods high in fats, sugars, and salt. A diet rich in these unhealthy foods can further strain prostate health, increasing inflammation and contributing to weight gain, which is another risk factor for prostate problems. This poor diet can create a vicious cycle that worsens prostate health over time. Heavy alcohol use also weakens the immune system. The prostate, like other parts of the body, depends on a strong immune system to protect it from infections and diseases. When alcohol compromises the immune system, it makes it harder for the body to fight off harmful bacteria, viruses, and even cancerous cells that might affect the prostate. This weakened immune defense can leave the prostate vulnerable to a variety of issues, including chronic infections and malignant growths. Furthermore, alcohol can interfere with the medications prescribed to treat prostate conditions. Many medications, such as those used to treat BPH or prostatitis, have side effects when combined with alcohol. Alcohol can reduce the effectiveness of these drugs or cause them to interact in dangerous ways, potentially leading to adverse reactions or making it harder for patients to manage their prostate health. While moderate alcohol consumption may not have as severe an effect on prostate health as heavy drinking, there is still evidence suggesting that even small amounts of alcohol can contribute to problems. Studies have found that men who drink even modest amounts of alcohol regularly have a higher risk of developing prostate conditions compared to those who avoid alcohol altogether. This reinforces the idea that minimizing alcohol consumption is an important step in protecting prostate health. Next, we have artificial sweeteners. Artificial sweeteners, commonly used as a sugar substitute in many food and beverage products, have been a topic of controversy in recent years. While they are marketed as a healthier option for those looking to reduce sugar intake, research suggests they may have a negative impact on prostate health. These sweeteners, including aspartame, sucralose, and saccharin, have certain properties that could exacerbate or contribute to prostate problems. Understanding how artificial sweeteners affect the prostate is crucial for those aiming to maintain or improve their health. One of the main concerns with artificial sweeteners is their potential to disrupt the body's natural metabolism. These sweeteners are often much sweeter than sugar, leading to an increased craving for sweetness in the diet. This craving can cause people to overconsume artificially sweetened products, which may lead to a higher intake of processed foods. A diet high in processed foods is known to increase the risk of prostate problems, including benign prostatic hyperplasia, BPH, and prostatitis. The additives in processed foods, combined with artificial sweeteners, can create an environment where the prostate is under constant stress. Another way artificial sweeteners may affect prostate health is by interfering with insulin regulation. Some studies suggest that artificial sweeteners can trigger an insulin response in the body, even though they don't contain any actual sugar. This is particularly concerning because insulin resistance has been linked to a higher risk of prostate issues. Insulin resistance can lead to an imbalance in hormone levels, and the prostate is sensitive to hormonal changes. An imbalance in insulin levels can further contribute to prostate enlargement and other prostate-related health problems. Artificial sweeteners are also known to alter gut bacteria. The human gut microbiome plays a crucial role in overall health, including the regulation of inflammation. Research has shown that artificial sweeteners can negatively affect the balance of beneficial bacteria in the gut, leading to an increase in harmful bacteria. This imbalance in gut flora can trigger systemic inflammation throughout the body, including in the prostate. Chronic inflammation is a key factor in the development and worsening of many prostate conditions, including prostatitis and prostate cancer. In addition to affecting insulin and gut bacteria, artificial sweeteners have been linked to an increase in oxidative stress. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body. This imbalance can cause damage to cells and tissues, including those in the prostate. Free radicals can damage prostate cells, leading to DNA mutations and potentially increasing the risk of prostate cancer. Artificial sweeteners, especially when consumed in large quantities over time, may exacerbate oxidative stress, putting additional strain on the prostate. There is also concern that some artificial sweeteners may be carcinogenic or cancer-causing. While the research is still inconclusive, some studies have suggested a potential link between certain sweeteners, such as aspartame and saccharin, and an increased risk of cancer, including prostate cancer. Though these studies are not definitive, they raise an important question about the long-term safety of consuming artificial sweeteners. Prostate cancer is one of the most common cancers among men, and anything that might increase the risk of its development should be taken seriously. Hormonal imbalance is another critical factor to consider when discussing the impact of artificial sweeteners on prostate health. The prostate is highly sensitive to changes in hormone levels, particularly testosterone and estrogen. Some artificial sweeteners have been shown to have estrogen-like effects in the body. These compounds can mimic estrogen and bind to estrogen receptors, potentially disrupting the delicate hormonal balance that regulates prostate health. This disruption could contribute to the growth of abnormal prostate cells or increase the risk of prostate enlargement and other conditions. Artificial sweeteners also have a potential effect on the body's ability to detoxify. Many sweeteners are made from chemicals that the body needs to break down and eliminate, and if these chemicals are not efficiently processed, they can accumulate in the system. The prostate, like other organs, relies on efficient detoxification to maintain its health. If the body is burdened with excess chemicals from artificial sweeteners, the prostate may struggle to detoxify and stay healthy. This could lead to an increased risk of prostate problems, including inflammation and tumor growth. Another concern with artificial sweeteners is their impact on blood sugar levels. While these sweeteners are often promoted as being beneficial for those with diabetes, they may actually contribute to metabolic dysfunction. Some studies suggest that artificial sweeteners can affect the body's response to glucose, leading to higher blood sugar levels over time. Chronic high blood sugar is a known risk factor for prostate problems, including BPH and prostate cancer. The relationship between blood sugar regulation and prostate health is complex, but there is evidence to suggest that artificial sweeteners could worsen the situation. Next we have caffeine. Caffeine is one of the most widely consumed substances in the world, often found in coffee, tea, energy drinks, and even certain medications. While it can provide a temporary boost in energy and alertness, there are growing concerns about its impact on prostate health. For men, especially those dealing with prostate issues such as benign prostatic hyperplasia, BPH, or prostatitis, caffeine may worsen symptoms and contribute to long-term health problems. Understanding how caffeine affects the prostate is essential for making informed choices about diet and lifestyle. One of the primary ways caffeine affects prostate health is by acting as a diuretic. This means it increases the frequency of urination, which can be problematic for men with an enlarged prostate. The prostate naturally enlarges with age, and frequent trips to the bathroom can be uncomfortable and disruptive. Caffeine exacerbates this issue by promoting more frequent urination, leading to increased strain on the already stressed prostate. For men experiencing BPH, this can result in more irritation and discomfort. In addition to its diuretic effect, caffeine has been shown to increase the production of stress hormones, like cortisol. Chronic stress is a significant factor in many prostate problems, as it can lead to inflammation, which is linked to conditions like prostatitis and BPH. Elevated cortisol levels can also impair the body's ability to regulate inflammation effectively. As a result, caffeine's stimulation of cortisol production may worsen inflammation in the prostate, making it more prone to pain and swelling. Caffeine is also known to affect the smooth muscle tone in the bladder and prostate. It can cause the muscles in the bladder to contract more frequently, leading to an increased feeling of urgency when it comes to urination. This heightened urgency can be particularly uncomfortable for men with prostate enlargement, as the prostate already puts pressure on the urethra, making it harder to urinate normally. The added effects of caffeine can make it even more difficult to empty the bladder completely, leading to a sensation of incomplete urination. Another factor that makes caffeine potentially harmful to prostate health is its impact on blood circulation. Caffeine is a vasoconstrictor, meaning it narrows blood vessels and increases blood pressure. Chronic high blood pressure can negatively affect the prostate, as it puts added pressure on the blood vessels that supply the organ. Over time, this increased pressure can result in poor circulation, which can impair the prostate's ability to function properly. Poor circulation can also hinder the healing process if the prostate is dealing with inflammation or other issues. Caffeine may also contribute to hormone imbalances, particularly those involving testosterone and estrogen. Research has shown that excessive caffeine consumption can alter the balance between these two hormones, which plays a crucial role in prostate health. An imbalance between testosterone and estrogen can promote the growth of prostate cells, potentially leading to the development of prostate enlargement or even prostate cancer. As the prostate is highly sensitive to hormonal fluctuations, caffeine's interference with this balance could make it more difficult to maintain a healthy prostate. Oxidative stress is another concern linked to caffeine consumption. Caffeine increases the production of free radicals in the body, which can cause damage to cells, including those in the prostate. Free radicals are unstable molecules that can damage cellular structures and DNA, leading to inflammation and, over time, cellular mutations. These mutations can increase the risk of prostate cancer or other prostate-related diseases. The more caffeine is consumed, the greater the buildup of oxidative stress, which can significantly damage the prostate over time. For men who suffer from prostatitis, the condition characterized by inflammation of the prostate, caffeine can make symptoms worse. Caffeine is known to irritate the bladder and prostate, exacerbating the pain and discomfort associated with prostatitis. Even in mild cases, caffeine can contribute to a cycle of irritation and inflammation that makes it harder for the prostate to heal. This can lead to a longer recovery period and a heightened risk of developing more severe prostate conditions. Caffeine can also interfere with sleep patterns, which in turn can negatively impact prostate health. Poor sleep has been shown to increase inflammation in the body and hinder the immune system's ability to function effectively. Chronic lack of sleep can impair the body's natural healing processes, including the ability of the prostate to recover from any damage or inflammation. For men with prostate problems, adequate sleep is essential for maintaining overall health, and caffeine's ability to disrupt sleep may further exacerbate prostate issues. One of the most concerning effects of caffeine on prostate health is its potential link to prostate cancer. While the research on this topic is still inconclusive, some studies have suggested that high caffeine consumption may increase the risk of prostate cancer. Caffeine may stimulate the production of certain growth factors that promote the growth of cancerous cells in the prostate. While more research is needed to fully understand this connection, the possibility that caffeine could contribute to the development of prostate cancer should not be ignored. Finally, caffeine can also disrupt the body's electrolyte balance, particularly levels of calcium and magnesium, which are crucial for prostate health. When caffeine causes the body to excrete more calcium, it can lead to a deficiency, which may weaken prostate function over time. This imbalance in electrolytes can also affect muscle function, leading to further complications for men with prostate issues. The long-term effects of this electrolyte disruption can exacerbate the problems already present in the prostate, making it harder for the organ to maintain its normal functions. Next, we have dairy products. Dairy products, often considered a staple in many diets due to their high calcium content and other nutrients, can have a negative impact on prostate health. While they provide essential vitamins and minerals, research suggests that consuming dairy products in excess may contribute to various prostate issues, including benign prostatic hyperplasia, BPH, and prostate cancer. It's important to understand how dairy affects the prostate and why moderation is key when it comes to these foods. One of the main concerns with dairy products is their content of saturated fats. Many dairy products, particularly whole milk, cheese, and butter, are high in saturated fat, which has been shown to have a negative effect on prostate health. High levels of saturated fat can increase the risk of prostate enlargement and inflammation, both of which are common prostate conditions as men age. When consumed in large amounts, these fats can contribute to an unhealthy balance of fats in the body, which can trigger inflammation in the prostate, making it more susceptible to disease. Dairy products also contain a type of protein called casein, which has been linked to increased cancer cell growth in the body. Some studies have suggested that casein may promote the growth of prostate cancer cells by influencing the production of certain growth factors. These growth factors can stimulate cancerous cells to multiply, leading to the spread of prostate cancer. The connection between casein and cancer cell proliferation is still being studied, but it's a concern for those with a family history of prostate cancer or those at risk. In addition to casein, dairy products contain hormones that are naturally found in animal milk. These hormones, such as estrogen, are present in the milk of cows and other dairy-producing animals. Since the prostate is highly sensitive to hormone levels, the intake of additional hormones through dairy can contribute to hormonal imbalances in the body. An imbalance between testosterone and estrogen can lead to the growth of abnormal prostate cells and the development of conditions like BPH. For men looking to maintain a healthy prostate, limiting hormone intake from dairy products is an important consideration. Lactose, the sugar found in milk, is another factor to consider when evaluating dairy's impact on prostate health. While lactose intolerance is common, even men who can tolerate dairy may face issues related to the body's ability to process lactose. In some cases, lactose can trigger inflammation in the gut, which in turn may promote systemic inflammation throughout the body, including the prostate. Chronic inflammation is a major contributor to the development of various prostate conditions, including prostatitis and BPH. For men with prostate issues, consuming large amounts of dairy could worsen inflammation and make symptoms more severe. Another concern related to dairy products is their potential to raise insulin levels. Dairy, particularly milk, has been shown to stimulate insulin production in the body. Insulin is a hormone that regulates blood sugar, but when produced in excess, it can lead to insulin resistance, a condition that increases the risk of prostate problems. Insulin resistance has been linked to an increased risk of prostate cancer and other prostate-related diseases. Therefore, regular consumption of dairy products that spike insulin levels could increase the likelihood of prostate issues over time. Furthermore, dairy products can contribute to oxidative stress in the body. Oxidative stress occurs when free radicals overwhelm the body's ability to neutralize them with antioxidants. Dairy products, particularly those that are processed, can increase the production of free radicals. These unstable molecules can damage cells, including those in the prostate, leading to DNA mutations and increasing the risk of cancer. Over time, oxidative stress may lead to chronic inflammation, which further contributes to prostate problems, including BPH and prostatitis. For men who are already dealing with prostate issues, consuming dairy may exacerbate symptoms. Dairy products can irritate the bladder and increase the frequency of urination, which is a common issue for men with BPH. The added strain from frequent urination, combined with the potential for increased inflammation caused by dairy, can lead to more discomfort and difficulty managing prostate symptoms. Reducing or eliminating dairy may help ease some of these symptoms and improve quality of life for men struggling with prostate health. Dairy's potential to disrupt gut health is another factor to consider. Research has shown that the gut microbiome plays a significant role in regulating inflammation throughout the body, including the prostate. The bacteria in the gut help modulate the immune system and prevent excessive inflammation. However, the consumption of dairy products, particularly in excess, can negatively affect the gut microbiome, leading to an imbalance between beneficial and harmful bacteria. This imbalance can trigger systemic inflammation that affects the prostate, worsening existing conditions and potentially contributing to new issues. There is also evidence to suggest that the overconsumption of dairy products may contribute to weight gain, which is a known risk factor for prostate problems. Dairy products, especially high-fat varieties, are calorie-dense and can lead to excessive calorie intake when consumed in large quantities. Obesity has been linked to an increased risk of prostate enlargement, prostatitis, and prostate cancer. By contributing to weight gain, dairy can indirectly affect prostate health, making it more challenging for men to maintain a healthy prostate. Lastly, while dairy products can offer some nutritional benefits, such as calcium and vitamin D, these nutrients are not exclusive to dairy. There are plenty of alternative sources of calcium and vitamin D, such as leafy greens, nuts, seeds, and fortified plant-based milks. By exploring these alternatives, men can reduce their dairy consumption without sacrificing essential nutrients, all while protecting their prostate health. Last, we have spicy foods. Spicy foods, while loved by many for their bold flavors, can have unintended negative effects on prostate health. The compounds found in spicy foods, such as capsaicin, which is responsible for the heat in peppers, may irritate the prostate and contribute to inflammation. For individuals with pre-existing prostate conditions like benign prostatic hyperplasia, BPH, or prostatitis, consuming spicy foods can worsen symptoms and lead to discomfort. Understanding the specific properties of spicy foods and how they affect prostate health can help individuals make informed choices about their diets. Capsaicin, the active ingredient in chili peppers, is known for its ability to trigger a sensation of heat and pain. While capsaicin has some potential health benefits, such as promoting digestion and improving metabolism, it can also cause irritation to the tissues in the digestive tract, including the prostate. For individuals already dealing with prostate inflammation or enlargement, the irritation caused by spicy foods can exacerbate symptoms like frequent urination, discomfort, and pelvic pain. This can make managing prostate health more challenging and uncomfortable. In addition to capsaicin, spicy foods often contain other ingredients, such as garlic, onions, and hot spices, that can stimulate the digestive system. These ingredients may irritate the bladder and prostate, especially in those with sensitive digestive systems or pre-existing prostate conditions. When the bladder is irritated, it can lead to increased urgency and frequency of urination, which is a common symptom for men with BPH or prostatitis. The irritation from spicy foods can worsen these symptoms and make it more difficult to manage prostate health effectively. Spicy foods also have the potential to increase body temperature, a process known as thermogenesis. This rise in body temperature can cause inflammation throughout the body, including the prostate. Chronic inflammation is a major contributing factor to the development and worsening of prostate conditions. Inflammation in the prostate can lead to swelling, pain, and urinary issues, making it harder for individuals to maintain normal prostate function. By consuming spicy foods, individuals may inadvertently promote a state of inflammation that puts additional strain on their prostate health. Furthermore, spicy foods can trigger acid reflux and heartburn, which are both linked to prostate discomfort. When spicy foods irritate the stomach lining, they can cause acid to back up into the esophagus, leading to a burning sensation in the chest and throat. This acid reflux can exacerbate symptoms of prostatitis, as the increased acidity in the stomach may also affect the prostate gland. For men who are prone to acid reflux, consuming spicy foods regularly can increase the likelihood of experiencing these uncomfortable and potentially harmful effects on prostate health. Another concern with spicy foods is their potential to disrupt the digestive process. Spicy foods can sometimes lead to digestive issues such as bloating, gas, and diarrhea. These digestive disturbances can create additional pressure on the body, causing discomfort in the abdominal and pelvic areas. When there is increased pressure on the prostate, it can lead to increased pain and discomfort, especially for individuals who already suffer from prostate issues. By avoiding or reducing spicy foods, individuals can minimize digestive disturbances and reduce the strain on their prostate. Spicy foods can also have a dehydrating effect on the body, which can indirectly impact prostate health. The capsaicin in spicy foods can stimulate the production of sweat, leading to fluid loss. Dehydration can make urine more concentrated, increasing the likelihood of irritation in the urinary tract and prostate. For individuals who already have prostate problems, dehydration can make urination more difficult and uncomfortable. Ensuring adequate hydration is essential for maintaining prostate health, and consuming spicy foods in excess may interfere with this balance. In addition to their direct effects on the prostate, spicy foods are often consumed in combination with other unhealthy ingredients, such as fatty meats, processed foods, and excessive amounts of salt. These foods can contribute to inflammation, poor circulation, and weight gain, all of which can negatively impact prostate health. By consuming spicy foods in combination with these other harmful ingredients, individuals may increase their risk of developing or worsening prostate conditions. A balanced, anti-inflammatory diet is crucial for maintaining prostate health, and spicy foods that are paired with unhealthy ingredients may not be beneficial in this regard. Some research has suggested that spicy foods may increase the levels of certain stress hormones, such as cortisol, in the body. Elevated cortisol levels can contribute to inflammation and weaken the immune system, which can further compromise prostate health. The stress response triggered by spicy foods may have a cumulative effect on the body, leading to long-term issues with inflammation and immune function. For those who are already struggling with prostate health, the added stress from consuming spicy foods could exacerbate existing symptoms and make it harder to manage the condition. Finally, while spicy foods may provide temporary relief from some symptoms, such as improving circulation or clearing sinuses, the long-term effects on prostate health may outweigh these benefits. The irritation, inflammation, and digestive disturbances caused by spicy foods can contribute to a decline in prostate function over time. Men with prostate issues should consider moderating their intake of spicy foods to avoid triggering negative effects and to support long-term prostate health. By opting for gentler, more supportive dietary choices, individuals can help reduce inflammation, improve digestion, and support overall prostate function.